how you make it? Yeah. So I didn't give that, but if you look at the reference, I have a number of papers where it says maybe actually one slide has that schematic. We'll talk about it, but you can always read more of the description of that. What are the different layers of how you assemble the blood-brain barrier? You also can commercially buy these phantom barriers. Okay.
Many companies make these barriers.
Not many, but there are companies that make. You can buy like a phantom this blood-brain barrier or phantom skin barrier, skins. In case of a skin, actually, you can even buy real skin pieces to experiment too. But the only thing is that the skin, if you use dead skin, it behaves very differently from live skin. So what you test on dead skin, the piece of the skin, not really the same as. So I will get 3 हुआ 2 और 2 questions. Somebody should ask. Huh? Yeah, you again, okay.
Yeah. And we were irradiating the sample, suppose, with wavelength 980 nanometer, and then there was an
emission at 800.
So you said that it was not, it was a 2-photon phenomena because it cannot be 1. Definitely it is more than 1. So quantization, is it lying over here? Means not 1, then it has to be 2.
Well, you cannot have 1.5 photon absorbed.
Definitely.
You have 2 photon absorbed, but not all the energies of the 2 photons are emitted as a light, as a photon. That's why it's only less than, if you sum the energy of 2 980 photon, it's much more than the energy of 1 800 photon coming out. So that excess energy goes as a heat. As we talked about in Jablonski diagram, the part of the energy can go as a heat, and part of them will be emitted. But you want to make sure that you get a maximum emission if you want to use, for imaging. If you want to use for photothermal therapy, then you want to convert them all into heat. Okay, last question. Somebody? You have a question, right? Huh? Afterwards, why not now? You can ask one now. आप ही पूछ लीजिए. I want to fill the quota of 5.
Yes, you know the 2 photons.
Yeah.
Then 1 packet of the total of the 2 photons can also be absorbed.
Can what?
1 photon having double energy, that can also be absorbed.
No, that will not be, because what is emitted is from a real level, electronic level. So if you put this much energy, but the electronic level is here, there is no way it's going to, it will not emit from there, it will relax to this level and emit. It probably will go someplace higher in energy. This excess energy releases heat, and then it emits from here. So it depends on the level of structure. Okay? Okay. Yeah. Okay, so let's move on. So one of the things we developed along that line in 2003, actually, this is not an appropriate reference, but anyway, is one of them, but there's earlier reference. In 2002, we developed a silica shell. And the silica shell inside, we put a different kind of optical probe or photodynamic therapeutic drug or magnetic probe. And क्या हुआ? Something fell?
Some spark has
Oh,
शॉर्ट सर्किट हो गया उसको डॉक्टर पर वो काया विषय आशीष फोटो है
so and then on the surface we put this targeting group, and we showed that we could target the cancer cell, we can image it, we activate the therapy. This was very early, so you can see it was like almost 16 years ago. And we call this Nano Clinic. It's like a small nano-sized mobile clinic to do diagnostic by imaging and deliver drugs, therapy, release. And here we were inspired by, there was a fiction in 1966 which was the fiction, name of the fiction was Fantastic Voyage. So if you go and look at Google, Fantastic Voyage, it was made a movie, and it was also a novel by Isaac Asimov. And the Fantastic Voyage was the story of a diplomat. The diplomat had a blood clot, and he was going to die unless the blood clot is removed within 24 hours. So the scientists, they came up with this scheme. They put the medical personnel, the instrument, which in this case was a laser to zap it and remove the blood clot, in the submarine, and they shrank the submarine to the nano size. And then they injected into the body stream of this topical injection. And then the submarine was driven looking for the blood clot and went to the blood clot. And then they cleared the blood clot. And then they had to get out of the body within 24 hours. Otherwise the submarine will go back to the original size. So they managed to do it and save the life of a diplomat. So we were very inspired by that. This is what I was thinking about, thinking outside the box, imagining something that is more like a fantasy. So we said, well, let's make this submarine, nano submarine, right? And so we made this nano clinic. So this is like a submarine, and the engine is provided by this targeting group. The targeting group is looking around for the antigen of the cancer cell. Where is the disease cell? It's looking for it, right? So we made this and we patented it, this concept. And then I had a postdoc from France, this Frenchman who came over there, and he worked on it actually, so he was part of the team. So he is in this patent, and he was going to have a firstborn son. And he didn't want the son to be born in the US, because then that son is not French citizen by birth, he's American citizen. And he wanted his son to be born French citizen. So he said to me, Dr. Prasad, I'm not going to stay here, much longer. I want to take my wife to France, where she will deliver the baby, and the baby will be French citizen. I said, okay, well, it's a personal choice, I cannot push him. And so he went there, and then he said, I don't want to do postdoc, another postdoc. I don't want to go in academia, I want to start a company. Can you help me? And I said, okay, I'll help you. I liked him and he was aggressive. I always support my researchers. So I became one of the founding father of that company. And that company was called Nanobiotix. Here, you can go and look at their website. It's in Paris, France. Okay? So he decided to open this company, license this patent on Nano Clinic and I start, focusing on a disease, a cancer, particular cancer. And very ambitious guy, but he realized that he's also not a businessman. So he partnered with somebody who had an MBA degree, who was a businessman. The two of them together pushed this company. And that company now is worth $300 million US, and they are actually finishing successfully clinical trial to treat certain kind of cancer, sarcoma, and which will be in a few years in patient care. Okay, so here is what I wanted to also said to you in the first day, that you really need to dream big, think out of the box, and believe in yourself, and be persistent in your efforts. Okay? So that's one successful example of nanotherapy that we'll talk about a little bit later again. Okay, so if you're looking at cancer using a nano platform, you can do many different kinds of therapy. You can use nanoparticles formulation that's magnetic. So in this case it had iron oxide. This was our patent number. And you can treat it by magnetically, effect on these nanoparticles. So there are two effects. One of them is that if you put in an AC magnetic field, you can heat, hyperthermia, and kill the cancer tissue by raising the temperature very high. Okay. The other one we showed is that if you supply even DC field and you put enough nanoparticles intracellularly, they align in a magnetic field and mechanically break the cell structure. And that works too. Chemotherapy, where you can load the drug and deliver the drug, and we have used it for pancreatic and prostate cancer. We are using it. Gene therapy, where we take the nanoparticle and put a charge on that and bind negatively charged DNA. We deliver it, or RNA, to silence certain kind of gene. And we have done it in head and neck cancer. We work with a medical doctor, Dr. Sinha, Southern California. Photodynamic therapy, where you have a chemical organic dyes that are called photosensitizer, and you excite them and they generate reactive oxygens to kill the tumor. And then lastly, neutron capture therapy. It's a nuclear therapy where you send a neutron particle and the nanoparticle can absorb the neutron. The neutron can get into the nucleus of these atoms in the nanoparticle, and then they generate alpha rays, very reactive alpha rays, and the alpha rays can kill the tumor. It's a very strongly ionizing radiation, so they kill the tumor that way. So there are many ways of utilizing nano platform for cancer therapy. Of course, what you may be most familiar with is chemo. Okay? But this and this is very much dependent on organic structures and drugs and so on. Other ones utilize a different approach to kill. Okay, so as I said to you, we are now working on, after we worked on many different kind of formulations, we are working on only two kind of formulations. One, which is biodegradable. So these nanoparticles, they kind of get in there, and in course of time they fragment, break into little pieces, and they can get out. Our kidney filters out and gets out. Okay? And most polymeric nanoparticles you can design, and they can work by this mechanism. Okay? The other one is inorganic nanoparticles, where we can make them very small so that even if they don't break, they can get out. So this we already showed to you. One of them is micellar phospholipid encapsulation. The phospholipid breaks out in course of time, and then you can utilize them effectively. Okay, there is another PLA polymer over here with this kind of chain, this kind of side chain, allyl group, where you can attach through this kind of click chemistry pegylation group, or you can have over here this carboxylate on this end. You can have a positive charge by adding this amine, and then this one can actually be site for gene, attachment of gene, and you can characterize these reactions by NMR, as you have. Okay, and then you can manipulate. Degradation time can be manipulated by charge. So how many amine groups you put versus this other carboxylic group, that can determine the charge. And it says that bioelimination depends on many things, the temperature as well as this ratio. So you can manipulate again. Over here you need to use your chemistry inside. What kind of groups you can put in there that will be degraded in course of time. Cytotoxicity studies we will talk about, how we do toxicity studies also. Now here again is showing the design of these COAs, that you carboamide chemistry. These are standard chemistry that you can read, and again in my review it talks about details. You can attach antibodies at these anchoring sites to make them, and look at how the delivery is facilitated by these antibodies receptors. Okay. Now the drug, as I said, you can do it in, this is like preloading. So you can have drug molecules, say for something like this, and you have PLA polymer backbones, and when you actually try to form their nanoparticles in there, they can entrap these, okay, and so they're encapsulated inside, and course of time when it breaks up under certain pH, then they can be released, okay. And one important area is this multi-drug resistance. Okay, that means you need to have, there are certain cancers that if you send the drug, they are going to be not as effective. So we showed that indeed this combination that gets inside by a process called endocytosis. How many of you are familiar with what endocytosis is? All of you? No. So endocytosis means that suppose you have this nanoparticle and this has this targeting group antibodies. So when it comes next to a cell that is diseased and it has the receptors on the surface, which is antigen, that's a signature of that cancer, it recognizes and then hinges onto that. Okay? Remember, lock and key mechanism fits in there. So these nanoparticles now are hanging around, and then the cell looks at it and tries to engulf it inside. Okay? And that's what called efflux of drug inside, endocytosis getting out inside. So that process of engulfing the foreign object in the cell is what is called endocytosis. And if you have these receptors that grab it and push it inside, then it's called receptor mediated endocytosis, that process. Okay? So cells that consume that, if they're right size, and then they have the targeting group, endocytosis. But then when they get inside, they breaks up and they release these drugs, the drug can leach out of the cell too. This efflux, what it's called. So what you want to make sure that this process is more overwhelming than coming out, so that the inside the cell, the drug concentration is high to be effective. Okay? So here we have different cell line. This is one cancer cell line. So the first test you do, any nano formulation, let's talk about that. Let me see what I have. Well, so let's talk about this. So what do we do? What is the strategy? How many particles you have made? Firstly, you want to design a nanoparticle and have a scheme of how you're going to load it with different things, right? That's where again, one is that you recognize what is the payload you want to deliver, what imaging modality you want to use, so you want to have optical, then you want to have optical probe in there, you want MRI, then you want to have a magnetic probe in there, then you want the drugs, so how you encapsulate the drugs in there. So these are the payloads. Then you design the nano structure, how you want to incorporate these functions and payloads, okay? And then once you have made these nanoparticles, you want to characterize. Characterize means what? Firstly, size, shape, composition. Then you want to make sure the drug is loaded in there. How do you determine the drug is loaded in there? How do you kind of fingerprint certain chemicals? Standard chemical techniques. First is elemental, right? But that may not be specific enough because your nanoparticles may have functional group 2. So the second one is a spectroscopy, right? You can do IR spectrum, look at vibrational bands of this and see whether the dye is in there, okay? Your drug is in there. Your drug has certain vibrational IR spectrum, fingerprint, right? Or you can do UV visible to look at whether absorption band, electronic absorption band of the drug is there or not, right? So a spectroscopy is another way to ascertain that you have drug. And absorption or IR, which is also absorption, can be quantitative. That means you can characterize how much loading you have the drug. You want to have maximum amount of loading of a drug, not a very tiny amount, that is not very effective. The local concentration will not be high. So you characterize, let me sit down and spend a few minutes over here on this thing, and this portion of how you go stepwise, okay? You can see me still in the back? Okay. So I think you characterize the drug loading. Then after that, you want to look at their dispersion. And the dispersion, again, you want to make sure that it disperses in water. So if your nanoparticle has other ligand on the surface, which is hydrophobic, you want to do ligand exchange. Remember we talked about ligand exchange. So you exchange the ligand to make it dispersible in water. And then you characterize by DLS, dynamic light scattering. Is it dispersed or is aggregated? Aggregated means really much bigger size. What is the charge of it, right? And then you can monitor in course of time how stable it is. Do you have to make it and use it right away? Or you can disperse it and save it on the shelf while you prepare your animal, with a tumor to inject and study. So you study colloidal stability. And you want to have at least weeks of time. It's not like hours. You can use it then practically, right? So stability. So one is colloidal stability. Second one is the drug still inside and protected, or is kind of in course of time is leaching out? Okay, how stable is it held? So you can do this calibration in many ways, and the simplest one could be that you can filter out the nanoparticles and look at the left water and so on, and characterize it by a spectroscopy. Is there any drug in this water come out, right? So you characterize that. then you can do your, after you've done these, then you can put, or even before, you can put targeting group and pegylation group to circulate. And then you go to cellular studies. So you prepare a certain cell line. And the first cell line, the most widely used cancer cell line, which are easier to get actually, believe it or not. You would think the normal cell line is easier to get, but no, the cancer cell lines are easier because they are distinct and they proliferate very fast. So you can grow them very easily in the labs. And so one of the popular ones is HeLa cells. It's a generic cancer cell line. Firstly, you want to test that before you go to, let's say, you're looking at pancreatic cancer. You can also get pancreatic cancer cell line. But that comes later, that's difficult to grow and all these conditions. So HeLa cell line. And then you incubate that with nanoparticle. That is a certain buffer solution you mix with the cellular suspension, which is again, so you want to, in a medium where you can oxygenate and keep the cells alive. And then you see after certain hours, time sequence, under microscope, if these nanoparticles light up, you see how much emission is coming out from the cell inside. That tells you how much nanoparticle has gotten in there. But that's not quantitative. Quantitative could be that then you dry the cell sample and you can do mass spec analysis. Okay? And so inductively coupled mass spec analysis we do routinely. Then you want to find out how much of the nanoparticle is inside. You can also do TEM on the dried sample and count how many nanoparticles are looking in there. Are there many or there are one or two? Okay? So these are quantitative characterization of cellular uptake. Okay? And then you want to do viability test, cell viability test. That's called cellular toxicity. And cellular toxicity is what is called cytotoxicity. So cytotoxicity determines whether the nanoparticle itself is toxic or not. So in biology, you always have a control experiment. You have one, there is a nanoparticle without drug loading, another one which is with a drug loading. So you take the one blank one and you do the experiment and then you do what is called live dead cell assay. There are certain dyes that easily permeate into a dead cell. Because dead cell, the membranes are broken, so the dyes can get inside there and stain the whole cell, and you can image. So by looking under a microscope, which cells are colored and which are not, you can say which cell is dead and which is alive. That's called live dead assay. So you do that. And hopefully in the control, most of the cells are alive. Then you go to the other one and you treat. And you treat with the drug thing. And then you say, well, how many died from the drug release? That gives you effectiveness of this, right? So in biology, always you do control experiment, one without or one with, and show that there is definitely a statistically significant. So you cannot do experiment one time. You need to do at least 3 times to show that it's real, not just happen. Okay? And so that's a cellular level cytotoxicity study. So I have a big review. It's a chemical society review on nanotoxicity, how you systematically study the toxicity of nanoparticles. Okay? Then what is the next step? You go to the animal studies. And in animal studies also, before you do the therapy so on, you want to make sure that the bare nanoparticle is not toxic. Because cell study is not enough. Cell checks you only at cell level. What about if these nanoparticles react with extracellular matrix that bind the cells together and damage that? Okay? Or collagens that support. So you want to do it at animal level. So animal level, you inject the nanoparticles, the bare one, to see how toxic the nano formulation itself is, or the one where the therapy you can activate from outside. That means without activating therapy, you use it, control, and you want to see if the animal's behavior first has changed. If it is toxic, the animal may not eat, may be hungry, not hungry, may be acting weird, somehow, may be very lethargic, maybe not sleeping, so all these behavior changes. First we look at behavior changes, right? And then if the behavior change shows there is no behavior change, that means it's not toxic, right? But still, you don't know if there are any kind of, it's a behavior, right? But you don't know, maybe it has caused damage to some organs, and you don't know, that may not have affected the brain somehow. So you sacrifice the animal, and you look at different organs, specimen of the liver, kidney, spleen, heart, all these tissues you look at under microscope and see if you see any damage evidence of a structure. Okay? And again, if you want to control, you can look one animal without nanoparticle, one with nanoparticle, compare the two after same days, right? And from there you can see if there are any changes, morphological changes or any damage evidence of the tissue structure, damage, eroded, broken, something. So then from that you can, if you don't see, then it's okay, it's safe. Okay? And then another experiment you do, which is after 10 days, are these things gone? And how do you do that? Well, one thing is to sacrifice and look at it. The other one is that in course of time, every day you collect the urine and feces, right? What it excretes, you look at that by your emission, light emission and so on. If there is any light emission coming out from the urine sample or from feces, if the thing is being eliminated, they will light up too. If nothing eliminated, there's nothing coming out in urine, nothing coming out in stool, right? So you examine that as well. And then you do pathological examination, sacrifice and look at it. So this is the way you kind of progress in any nano formulation of drug. It's a long process. And you need to be able to do all yourself. This is where, maybe you can make materials, nano formulation, characterize, do DLS and all these others. And then you work with a biology friend who can do these cellular studies or animal studies. As some of you said, well, I don't know, I don't want to touch mice. And as I said, you got to wear gloves because sometimes they bite you if you're trying to inject or clamp something. So you got to be careful, So my students, if they're working in animal, in the US there are strict regulations even working with animals. You need to take a course and you need to kind of be certified to handle the animal and do animal experiment. Same thing, our storage area, we have to have a license to be able to store the animal and do their studies. So eventually then, just for your information's sake, where do we go? Suppose you have done testing in mice and everything looks great. Where do you go from there? Well, you would go to a bigger animal, first step, and then prove that it works in bigger animal. Then you have all these data and so on. And if you are brave enough yourself and have gotten a lot of money from different companies or whatever, then you can apply to Federal Food and Drug Administration or equivalent of that in India. I don't know what it's called. And then they will review your application with all the data showing everything has worked, there is no toxicity, is eliminated, it benefits, kills, the efficacy rate is high. Then they will grant you permission to try on humans. That's what is called trial. And the human, there are volunteers. And the volunteers generally are people who have given up on other treatments and say, what have I got to lose? Let's try it. And sometimes there are people, they can be paid for the test. So they sign consent that, okay, I give permission to be tested, and in lieu of that they get some money. Okay, so they are ready to be tested, and then you conduct trials, look at toxicity, the same repeat experiments that you did with animals. You don't sacrifice the human, you just do biopsy. You take a little piece and study that, right? So, and then with all the results you submit, and you get approval to actually treat patients by that. So it's a long process. So first when you come up with the idea of what nanoparticle you make and what you want to load and what disease you target, that's your concept, that's your imagination. You start from there, you're talking about easily 15 years before it can be in patient care, if it's all successful. Most of them will either fail or stop at certain place. Only some of them will make through. And it is all of them, all drugs, yeah. And it is easier if you are providing nanoparticles as a carrier. You're just loading it and delivering it. That is somewhat a different procedure for approval than when you have chemically conjugated the drug to nanoparticles or any treatment agent, because when you conjugate, it's now a new chemical. It's chemically bonded, it's a new formula. And then it's more complicated. Also, believe it or not, if a nano formulation you have is considered as a device rather than for therapy, or if it is considered as a health aid, not a drug, is a very different thing. Because if it is considered as a vitamin or supplement, it's a lot easier. If you can say it is not a disease of the skin, but it is cosmetic, a lot easier, to get approval. So I have a chapter in my book, it's called Nano Cosmetics, okay, where you can use nano formulation to encapsulate certain moisturizing cream or certain collagens to deliver for wrinkle removal, Yeah. So what happened? You make these cream formulations using nanoparticle delivery, and you're talking maybe few years to get into marketplace, not 15, 16 years. So maybe you can work on Nano Cosmetics rather than nano drug, nano-medicine. You know, anything which is external is easier to treat and easier to get approval of. Okay? So if you are doing, let's say, surgery, removing something, and particularly if it is growth that you can see either in your bladder or esophagus or skin or whatever, and you want to use nanoparticle emitters with targeting, you spread, so it lights up all the areas of tumor, right? And then you can do surgery because the surgeon can see lighting up region which is tumor and removes that part only, so it leaves the healthy part. So it's called image guided surgery. It's a big thing. And then when you remove it, what happens normally when they remove a tumor, that to make sure that it is safe, they remove some little extra, right? But if you have imaging, then when you remove it, and if it still lights up, that means there is some left, and you remove. So now they're talking image-guided robotic surgery. So the robots were doing cutting all this, and they are guided by sensor. They're looking at that emitted light, where it's coming from, and going there and carving out. Okay? So image-guided surgery may be easier. What else is easier? In vitro diagnosis, liquid biopsy, as I talked about. There you can take samples, saliva, or whatever, blood and all those, throw in nanoparticles and see, on a slide what is happening, lighting up or not. So in vitro diagnosis is also a lot easier to prove because not injecting anything in a human. Okay, so let's talk another half an hour. Or another question, anything related to? I told you nice stories. You don't have any questions? So you can always keep your mind open. If you don't want to be an academician, like my French postdoc, you can open a company with your invention. All right, let's some more, or are you tired? Another 15 minutes chalega? Chalo. Dr. Bose, 15 minutes, okay? Yeah. So, it's just some lines showing to you. Now, as I said, one other beauty of nano formulation is that you can do multiple therapy. So, in this case, is an example, I will come back to that you load the drug, which in this case was doxorubicin, very well-known chemotherapeutic drug. For many cancer, they use doxorubicin. You can entrap inside before it forms this nano pocket and encloses in there. Then because it has the amine groups, tertiary amine groups on the outside now, which forms the hydrophilic domain, and these ones positively charged, so you attach DNA which is negatively charged, or siRNA. These are genetic fragments, and we'll talk about gene therapy in a minute, what it is. And then, so you attach that, so you can do two. One is gene therapy and drug therapy together, dual delivery. It's showing that how the cells if those nanoparticles also have emitter together, either fluorescent dye attached to it or quantum dots, which you don't want to use unless it is silicon, okay, they can light up and they can show that yes, these are being delivered inside the cells. Okay, so let's look at different kind of therapies. Again, we are going to go, let me just go back to, here. So I'm going to talk about some of this light-based therapy, gene therapy, chemo is already, we talked about just including the drug. I'll give you some example. And then at the end of the lecture tomorrow, we'll talk a little bit about this radiation therapy or nuclear therapy using nano, which is very exciting and very new, except the question is where would you do the testing? In India, there are only a few places where they have nuclear reactor or accelerator to generate these particles. So we'll talk about that, the principle at least. So let's go back. Light-based therapy. So one of the therapy is what is called photodynamic therapy. This is where the idea over here is very simple, that you excite an organic molecule, which in most cases have been porphyrin structure. Porphyrins are fused ring organic structures, sometimes metal inside the ring structure, which is called macrocycles, or sometimes without metal. So this could be also organometallic, because the metal being iron being there, and these are called photosensitizers. So they are not really drug in the chemotherapy sense. The chemical itself does not interact with the cell, either nucleus or anything to kill, but it initiates a process that generates something to kill. So that's why they're called sensitizer, okay? And they're regenerated at the end. So what will happen is that in most of the mechanisms, you have light is absorbed in the organic one, like porphyrin, and it goes to excited state. Okay, singlet state. Remember Jablonski diagram we had? And then it crosses, intersystem crosses, remember ISC process. It goes from there to triplet state, which is long-lived. Okay? And then the triplet state, if it is of higher energy than the oxygen state, oxygen is one of the few molecules that in the normal ground state is triplet and is paramagnetic. And that was the biggest triumph of molecular orbital theory. When the quantum mechanics was starting and quantum chemistry, molecular orbital theory predicted that in case of oxygen, the lowest level, electronic level, is triplet. The spins are not paired. There are two molecular orbitals. They have each one electron. Okay? So they're paired, triplet. So it's triplet, and the triplet oxygen is not that powerful oxidant. You can breathe. It doesn't damage your lung or anything, right? It actually is stored in form of ATP as an energy. So what will happen is that this triplet state transfers energy to oxygen if this is less than this, and the oxygen goes from the triplet state to singlet. So the two electrons, which are normal state like this, they got excited state, they flip, they become paired, singlet. And this singlet oxygen is a very powerful oxidant. As soon as the singlet oxygen is formed, it destroys the local organic structure, it oxidizes them. Okay? So when it oxidizes them, the cell fragments, breaks down. So it kills the cancer. So your hope is that this and then this is recovered because this returns to ground state. So what does it need? It needs, in this mechanism, it needs a sensitizer, and then it needs oxygen around there to work. There is another mechanism where you don't need oxygen. It takes the other oxygen species which may be present and converts them into radicals. And the radical kills. There are two mechanisms. So what happens in treatment? Treatment, you take this and you inject it in either directly into the tumor or systemic. And this is a dispersant which could be nano formulation or just mixed with a surfactant to disperse the carrier. So we're talking about nano formulation maybe, so they go around every place, but even without targeting, this is what is intrinsic targeting in this case. These porphyrins have higher affinity for tumor cells, cancer cells. So they may go around, but if you wait for, let's say, a day or so, then every place has cleared out, and these are sitting still in the cancer cell. Then at that point, you irradiate with light, and it does this thing, right? And then the cancer cells break down. The tumor is shrinking. Then these photosensitizers come out of the cancer cells, and they're floating around other places. So after you have treated, you want to wait for a while for these molecules to come out of the body before the patient is exposed to sun. So they go in the dark, they get this injection, they wait for a while till it has cleared from other places, only in the tumor. Then you shine light, treat it, and then the patient stays in dim light for maybe a few days, because if he goes to bright light, the light can interact with the remaining photosensitizer other places and can do damage. So you want to, and this effect was actually, this method was pioneered in Buffalo. Half an hour, 20 minutes.
This photodynamic therapy, then today you close.
Huh?
Today you close after this.
Yeah. Okay, good. Thank you. We'll do that. So, so the idea is this, and it was invented in Buffalo. There is a cancer institute called Roswell Park Cancer Institute. So Buffalo, my hometown. Those of you who still remember what I said. So in my hometown, in the U.S., not in India. Okay, well, this was invented. It was invented by a chemist. His name is Thomas Doherty. He retired now. So, chemical therapy, but it is initiated by action of light. Okay, so now there are many different kind of sensitizers being made, but they're all fused ring. So one of the challenge is how you can activate this therapy, photodynamic therapy, at a longer wavelength, which can penetrate deep inside. Otherwise, you can only treat superficial skin cancer. So they're making photosensitizers that can absorb at a longer wavelength, like different windows of transparency. But the limitation is this, that this gap cannot be smaller than here. If it is smaller than here, then you cannot generate singlet oxygen. So there is a limitation of how long of an wavelength you can go to. Okay? All right. So this has been approved for many different kind of cancer, and many of them are in clinical trial, different stages, and some of them are approved. For a skin cancer, this is approved and already used in cancer treatment. Okay? And some of the, like inside the stomach thing where you can reach by light, is also approved. You can use it. For eye, it is approved. Okay, so nano platform, what does it offer? Well, one of them is that you can localize with imaging, these dyes up, and you can also use upconversion photodynamic therapy. That means like our nanotransformer together with photosensitizer, you only need half energy, longer wavelength. It goes to excited state by 2 photon, emits the light in the blue in the region. A blue light can be absorbed by the photosensitizer. So it's upconversion photodynamic therapy we can do. We can build imaging, can put targeting to enhance more accumulation in the tumor. And so we can have a favorable effect. You can also control in nano formulation by putting a heavy atom. You can enhance the rate of this. So let's just go back to, and then we will stop here because I was saying this effect. So to this effect to work maximum, what do you want to do? You want to use a nano formulation where this process is very effective. It populates here very effectively, first step. Second one is you want to make this more efficient. You don't want fluorescence in this case coming down here. You want it to cross to triplet, so there is a large population of triplet state. So you want to enhance intersystem crossing. Third one is that you want to enhance the process of transfer of oxygen. Even if you generate a lot of triplet, but a triplet lifetime is very short, it may come down fast here and not transfer the energy to oxygen. So you want to, so when you actually do photodynamic therapy, you have nano formulation, you want to make sure this absorption is very strong. Then you want to see this triplet formation is fast and efficient. You can probe the triplet formation. And then you want to say that this nanoparticle gets into the cell. This is called cellular uptake. And then you want to see whether oxygen, singlet oxygen is generated. And singlet oxygen you can monitor chemically because this can bleach certain kind of dye color very readily. And then by bleaching you can see that it is generated. Or you can monitor emission of singlet to this triplet phosphorescence that occurs at 1250 nanometer. By looking at this emission, you can say, yes, oxygen is generated. Okay? And then finally, you want to look at cell death. By eliminating light, how many cells are dying versus without light, how many cells are dying, right? So you compare that to with effectiveness. So anyway, here we had a nano formulation where we put heavy atoms, and heavy atoms make the effect of this crossing very efficient. So we showed that by putting even simple iodine in a nanoparticle connected to the photosensitizer in this organically modified silica network, it enhances the intersystem crossing and enhances the efficiency, triplet generation. So this is one way of manipulating. Here then we did that original work with this organically modified silica, where we can load the photosensitizer in many ways. This one was where we take the sensitizer covalently by chemical bond. You can conjugate on the surface of the nanoparticle. Okay, because remember, silica when you make, a lot of them are OH groups free on the surface. If they don't connect, bond that, and through there you can connect chemically, right? And so we showed that indeed we can take into the mice and we can do this. These are again. Then the other one we showed is upconversion through this aggregation enhanced dye, that this dye actually is, when it's excited by 2 photon, can transfer energy to the porphyrin, and that generates singlet oxygen to kill, so that this can be activated by longer wavelength light with by 2 photon excites. Okay. Let's skip this one. This is too specialized. This is upconverted photodynamic therapy. So rather than doing the direct two-photon absorption in the eyes, we can have these nanoparticles that take near IR light and convert that on the side to green light, and the green light can be absorbed by the photosensitizer, which goes to excited state, then triplet, and then this. So there is first step is absorption by this, upconversion being absorbed by photosensitizer, the photosensitizer transferring energy to triplet oxygen generate, and we showed that indeed we can kill cancer cells very rapidly. All right, nitric oxide is another one. Magnetophoretic control, I already talked about. The nanoparticle you can drag to show that you can enhance that. Okay, so photodynamic therapy, we stop now. Another kind of therapy we talk tomorrow, photothermal, where we actually don't generate these, reactive species, but it just, light is converted fully into heat. And the local temperature rises very high and it kills the cancer with the temperature effect. It denatures proteins and other things. Okay. 1 minute for any questions, anything? No? All right.